voices are if you talk. But I'm recording this session so that if you wanted to watch it, you'll see my face in the slideshow. And it'll be in the lecture in Canvas, and you can just click on it later when it's uploaded. So I don't know why you'd want to listen to this twice, but if you wanted to, if you got bored over the long weekend you're going to have, you could do that. Okay. All right, let me share this with you all. Bam. Bear with me. Integumentary system. Okay. Hold on. Let this pop up here. Supposedly. Here we go. Boom, boom, boom. All right. Okay. So let's really fast go through the integumentary system. This is stuff I think you should know 5 years from now. Okay? 5 years from now, this is actually all you should know. I'm going to tell you some other stuff, but 5 years from now, if somebody says the integumentary system, I want you to know that it means the skin, hair, nails, and glands of the skin, like your sweat glands and your oil glands. That's it. That's it. Now, don't get me wrong, we're going to go over some other stuff about the integumentary system that I think is kind of important, but what's really important is if somebody says integumentary system, I want you to think skin. Forever. And I think sometimes we throw so much information at you, you walk away and you can tell me stuff about the integumentary system and you forget it's about the skin. If that makes sense. Yeah? So the integumentary system is skin, hair, nails, and what they would call associated glands. It just means the glands that are found in your skin, which are things like, sweat glands and oil glands, right? The stuff you're intimately familiar with. When you have oily hair, it's coming from your oil glands in your skin. When you're sweating, it's coming from your sweat glands in your skin. Yeah? I know there are different types of sweat glands, and I know all that stuff, but the point is skin, hair, nails, and skin glands. Yeah? Yes. Good. So, Ms. Zwick, what is your integumentary system?
It is the system that contains the skin, hair, nails, and skin glands.
Thank you so much, Ms. Zwick. I could not have said it better myself. That was awesome. Mr. Ashok Ali, what is the integumentary system?
The skin, hair, nails, and skin glands.
Could not have said better myself. Thank you, sir. Bam. Awesome. Okay. And what does this stuff do for you? This is actually less important. It's not this less important. I know it's important what it does for you, but if you just sit down and think about it, you would figure a lot of this stuff out. You know the skin protects you from the outside world. It's the reason that germs and stuff don't get into me immediately. It is a coating over my body. Of course it provides protection. Of course it provides immunity. Of course. Right? That's why it's so dangerous when you put stuff in your mouth, because you get it past your skin. Right? That's why we care what we inject into our body and ingest into our body, because it's getting past our skin. But our skin is it's your number one barrier to infection. Right? You know it has sensation. You guys use it all the time to touch. You don't have to memorize that. Of course it helps with temperature regulation. Why do we sweat? Because you guys are evaporative coolers, and you sweat so that the air blows by your sweat and carries off heat. It also keeps you warm because it's got fat in it that it can help to seal in heat as well. Do you excrete through your skin? Yes, you do. That's actually why if you have gone out drinking the night before, sometimes you can smell the alcohol in your sweat because some of it gets excreted out your sweat. And we can smell many diseases, actually. I don't mean we can, but they've got trained dogs that can actually, proven now, smell many types of disease in your sweat. Ms. Cuppage, yes, ma'am.
I just have a quick anecdote. When I used to coach basketball camps, there was a kid that didn't have any sweat glands.
Yes.
And so he had to carry around like a little refrigerator pack.
Yep.
Back, and of course his mother was there at camp, so in case there was an emergency and it shut down or whatever, but it was could be highly fatal if he got too overheated because he couldn't cool his body down.
Yep, I actually had a friend like this too. And she liked to run, and she'd have to run in the middle of the night. She had to run when it was actually quite cool and stuff, yes. Because, by the way, guys, your arms and legs and things like that can get quite hot. Your skin can get quite hot, but if your core temperature goes up more than about 5 degrees, it's over. Like, it's not good. Yeah. Yeah, very. Oh, Miss Cuppage, by the way, since I have you on the line, what is the integumentary system?
It is skin, hair, nails, and glands.
Thank you, ma'am. So, guys, I don't even want you to memorize this second slide. I just wanted to kind of point out to you it's kind of common sense when you think about it. Yeah? Yeah. Okay. It is important to remember hyperemia because massage therapists do use this term a lot. And they also use the term vasodilation. Vaso means veins and arteries, and it means they've gotten dilated and there's more blood flow there. And it's usually when we see a spot on the skin that's red from rubbing. And we normally like to see hyperemia that we've created. Now, hyperemia we haven't created can mean there's an injury underneath the skin, but hyperemia we've created is usually a good thing. We're trying to increase blood flow. In fact, many people argue that the entire massage game is an increasing of blood flow game because blood is life. If you can increase blood flow to an area, you're probably healing it. So hyperemia is important to know, just that term. And it's important to know because it is caused by vasodilation, which means the arteries and veins have opened up, they've dilated, and you're getting more blood flow there. That's it. Cyanosis, which means looking blue, is important to know because if somebody looks blue, you should be calling 911. By the way, just to let you know. That is a sign they're not getting enough oxygen. And if you're seeing that kind of blueness, it usually shows up in the fingernails first. But if you're seeing that, call 911. Don't sit there and kind of wonder why they're turning blue. Call 911. We don't even have to talk about skin glands. But the point is you have sweat glands. I know you have multiple types of sweat glands, but you have sweat glands and oil glands. That's it. Boom. There was a lot of talk yesterday about all the layers of skin because there's layers within the layers. Guess what you need to know? Epidermis, dermis, and hypodermis. That's it. Epi means above. So epi is the dermis on top of the dermis. Hypo means under. Hypodermis is literally the dermis under the dermis. So it's epidermis on top of the dermis, hypodermis underneath the dermis. There are two other terms you should know. Hypodermis has two other terms that mean the exact same thing. Can anybody tell me what the other two terms for hypodermis are? Miss Cafiso.
Is it the subcutaneous layer and the hypodermis? Oh wait, no.
Super.
I only know the subcutaneous layer.
Cool. Who can tell me the next one? She's right about that.
Superficial.
Superficial fascia. This is very important, everybody. I actually like to call the hypodermis superficial fascia because I am fascinated with fascia. Let's think about this for a second. It's not the term so much, but it's the concepts that are important here. You've got epidermis on top. Your epidermis is basically dead, by the way. Your skin grows from the bottom up and then sloughs off. Most of the dust in your house is your skin. Just thought you should know. And it's good that it's dead because I can scratch my nail across it and I don't start bleeding. It's dead and it's what waterproofs me. The dermis underneath is quite alive, and that's where all the blood is. When you cut down to the dermis, you start to bleed. Underneath that is the hypodermis that kind of helps to glue your skin to the rest of your body. Now the hypo means under, so it's under the dermis, but you can also call it superficial fascia because the lowest layer of skin is the highest layer of fascia. Let me explain that. You've got fascia around your bones, right? It's called periosteum. It's fascia around your bones. You've actually got fascia through your bones, but let's just stick with this. Fascia around your bones. You've got fascia around each muscle fiber that's by your bones called endomysium. Fascia around groups of muscle fibers called perimysium. Fascia around the entire muscle called endomysium. And fascia around groups of muscles called deep fascia, actually. And then fascia around all that called superficial fascia. And then what's on top of that? Skin. So the top layer of fascia is the bottom layer of skin. So the most superficial fascia is the hypodermis. It's the subcutaneous layer. So you can call it epidermis, dermis, hypodermis. You can call it epidermis, dermis, superficial fascia, then like deep fascia, then, epimysium, paramysium, endomysium, all that kind of stuff. But the point is you've got all these layers. That's what I want you to remember. I didn't care about the names, to be very honest with you. I want you to realize you have layers and 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 layers of fascia. You are bags around bags around bags around bags around bags. We're going to talk about that more in this lecture. That's what's important. Cool? Yes. All right. So there are 3 words for hypodermis. Hypodermis, subcutaneous, superficial fascia. Yeah? Cool. Mr. Bigelow, what are the three terms for the bottom layer of skin?
That would be superficial fascia, subcutaneous, and hypodermis.
Yes. Which one's my favorite?
Superficial fascia.
Damn straight. Thank you, sir. Miss Vega.
Yeah,
Miss Vega, what are the 3 terms for the bottom layer of skin?
the hypodermis, the superficial fascia, and I can't remember the other one. My bad.
Subcutaneous means under the skin. I don't care about that one anyway. Good. Which one's my favorite?
The superficial fascia.
Thanks. That's all I care about. Let's go. Moving right along, everybody. Boom. I put this up here to make a point. I put this up here really quick to make a point. Your brain has a very large section of it called the postcentral gyrus. Don't worry about that word. You'll never hear it again for the rest of your life. It doesn't even matter. This concept's actually very important. You have a large section of your brain that's meant to deal with all your skin sensations. That's all it does. Well, look at this chart really quick and notice how much of it is dedicated to your hands and face and feet, and how little of it's, and your tongue, and how little of it's dedicated to the rest of your body. This is why your hands are more sensitive than your back. This is why little kids, all you mothers out there and fathers, what do little kids do? They put everything in their mouth. What are they? They're actually feeling things. They're not trying to eat everything. Your lips are super sensitive. This is why we kiss. It's a super sensitive area in your body. So the vast majority of your sensors in your skin, areas in your brain that are dedicated to sensing, are much stronger. There are even more brain and nerve tissue dedicated to hands and feet and head. So this tells you a couple things. One, it tells you that if you're a massage therapist, you want to feel something, you should use your hands. It also tells you these are very key high nerve areas of the body: feet, hands, head, and neck. And so you're going to have lots of sensation. This is, in a way, why you can go so deep on somebody's back, because they don't feel it the same way they did if you put an elbow in their face, right? Even I don't do that, by the way. That's a little over the top, okay? Just make that clear. All right. But the term and everything doesn't matter. Nociceptor. So, nociceptor is something you might want to remember. You have little nerve endings in your skin. You guys haven't gotten to the nervous system yet, but you have nerve endings. You have ends to these wires that sense things. And nociceptors, they're really your pain receptors. And they quite literally sense chemicals that get released when your skin and muscles are damaged. So they're actually sending a pain signal quite often because true damage is being created. Like when you burn yourself. The nociceptors actually pick up the chemical reaction of cells being destroyed and send you a signal that says, ouch. Now, actually, you don't really feel pain, but your brain tells you to feel pain, so you'll pull your hand back. But that's a whole other discussion. All you feel is, all that goes to your brain is a little signal that goes, dee 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 dee. But your brain's learned that means that you were destroying your hand and you need to pull back from the fire really quick. So it tries to get your attention. But anyway, nociceptors are pain receptors. Nociceptors are pain receptors. Nociceptors are pain receptors. And that's something good to kind of remember. Miss Cafiso, what are nociceptors?
They are pain receptors.
Awesome. Thank you, ma'am. Miss Tiscat. Miss Tiscat?
Yes.
What are nociceptors?
Pin.
Yeah. Pain sensors, pain receptors, pain.
Pin receptor.
Perfect. Thank you, madam. It's perfect. Yeah, it's great. Thank you.
Thank you.
You're doing great. That's it, guys. That's your integumentary system, which was hair, skin, and nails and associated glands. Right? That's it. That's it. That might come in handy down the road. All right, skeletal system and pathologies. Boom. Your skeletal system is your bones, cartilage, which is this really hard fibrous fascia between your bones, your joints, where two bones come together, and ligaments. Remember, ligaments are that fascia that connect bone to bone. Ligaments connect bone to bone. That's why they're put in the skeletal system. These are all made up, by the way, systems of the body, but the person who made this up decided that's what we're putting in here. So when you hear skeletal system for the rest of your life, you should think bones and cartilage, joints, and ligaments. When you hear skeletal system for the rest of your life, you should think bones and cartilage, joints, and ligaments. Miss Cuppage? Oh, Mr. Ashokali, were you going to say something, or was that an accident?
It was an accident.
Okay. Miss Cuppage, what is the skeletal system?
Bones, joints,
What's the fascia that connects two bones together?
ligaments.
Thank you. Cartilage would be in there too, but I could care less about that. Bones, joints, and ligaments is good enough for me. Yeah.
So not tendons? Or
No, because what do tendons do?
They connect bone to muscle.
Yes, so they put them in the muscular system. You're right. By the way, they could have put them in the bone system, but they decided to leave them with muscles.
Okay.
And by the way, tendons and ligaments look identical. It's just ligaments go from a bone to a bone. Tendons go from a muscle to a bone. Yeah, thank you. Ms. Stewart, what is the skeletal system?
Bones and cartilage and joints and ligaments.
Perfect. Thank you, ma'am. Again, guys, a lot of the stuff, the physiology of what your skeletal system does, you can figure out. Does it support you? Heck yeah. How am I standing up right now? Right? If I didn't have bones, I'd be a jellyfish, and I would be a blob on the floor. And you'd make fun of me. But I don't. I've got bones. Of course they provide support. Of course they provide protection. My rib cage protects my heart, lungs, liver, kidneys, really, all that stuff in there. Yeah? So of course they do. Of course they help with movement. That is important. They are the levers of your body. Right? Muscles hooked to bones, and they pull the levers of my body, and that is kinesiology. That's how movement occurs. That's important, but you know that. The thing you might not know, or you might forget, is they also produce blood cells, white and red. Red are the ones that get you oxygen and get rid of carbon dioxide. White ones are the ones that fight off infection. And it's kind of cool they're made inside your bones. It's kind of amazing if you think about it. The human body is loaded with stuff like this. I mean, loaded with stuff like this. It's almost like somebody was trying to really save space and weight and stuff. And so nothing in your body does just one thing. Whereas this room has, steel girders holding up the walls and stuff like that. Right? Which my bones do. They hold me up too. But they also produce life-giving blood and white blood cells too. So they're part of my cardiovascular system and part of my immune system. Right? It'd be like if I went over this wall right now and tapped off some hot cocoa, chocolate milk, eggs and bacon, whatever, it came out of the wall. I mean, so it's amazing that your bones do more than just provide structural support. And they do hold some fats and some minerals and such. I don't care about any of this slide except for one sentence here. And I hope you can guess what sentence it is because it's underlined and it's connective. The number one tissue in your body, is not muscular tissue. It is not nervous tissue. It's connective tissue. It is the most common tissue in your body. We don't think about it because it weaves through everything. but your bones are actually connective tissue. They are a lattice. They're like a spider web of all this like stretchy, tendinous stuff. We don't think about it that way because the lattice is filled in with calcium and potassium with concrete. But the connective tissue acts like rebar. In fact, bones have a little bit of flex because of that, believe it or not. They're really strong, but they have a little bit of flex, kind of like a tree in the wind. They have a tiny bit of flex, which is good because it keeps them from breaking. So bones are connective tissue, and it's connective tissue that what? Keeps remodeling. That's important. Yeah. Cool. Good. Miss Smith, what kind of tissue are bones made out of?
Connective tissue.
That is correct. Thank you, Miss Smith. Miss Dowler, this is going to come as a shock to you, but I want to know what kind of tissue bones are made out of.
Connective tissue.
Couldn't have said it better myself. Thank you, ma'am. Good. You guys already know this, but it's important to know you have an axial skeletal system and an appendicular skeletal system, and it's more important just to know it from the fact of like, a lot of problems occur where your appendicular skeletal system attaches to your axial skeletal system. So, to give you an example, this joint right here between the sacrum and the ilium, which is called your SI joint, your sacroiliac joint, a lot of people have problems in here because all the stresses from their upper body have to get transferred out through their hips down here. So hips are very important. And look at shoulders up here are very important because they have to attach to the axial skeletal system. Memorize anything else about it? Not important. Not important at all. But just kind of knowing that concept that literally is captured in this slide. I mean, if you just kind of remember how that looks, I think that's good enough. Hold on, bear with me 1 second. I've got to... There. I had to mute somebody. Didn't know they were unmuted. Okay. Of course joints are important, right? Bones in my body cannot act as levers if I don't have a joint to bend. Okay? Now they in the book have you talk about all the different types of joints. Does not matter. They just wanted you to realize that certain things could move in different directions. Like a hinge joint can only move back and forth. It can't go spinning around. Ball and socket can, but naming them's not important. Okay? Joints are also called articulations, and you will hear that. You will hear people call them articulations. Joints and articulations are the same thing. Joints and articulations are the same thing. Miss Flores, what is a different word for joints?
Articulation.
Thank you, ma'am. Miss Ratana, what is a different name for joints?
Articulation.
Beautiful, thank you. Boom. Really quickly, these names don't mean something, but I want you to just think about this for a second. Most of the joints we deal with in the body are this last type, the synovial joint. That's a cat, like my knuckles and my hand are synovial joints, my wrists, my elbows, my shoulders, my hips. Most things in your body are synovial joints. And they got a sac around them and a fluid, and I'll show you a picture here in a second. Cartilaginous joints are like in your spine, between your cartilage. They don't bend as much, but they're really strong. And then you've even got fibrous joints. Like my skull is actually multiple bones sewed together with fiber. And they say they don't move. They actually do move. But they move barely. They just flex a little bit. So just to give you a concept of that. But when we talk about joints, we're normally talking about synovial joints. We're normally talking about synovial joints. But this is a great picture. These are fibrous joints in the head. Basically don't move. These are cartilaginous joints. They have some flex. They can expand if they have to. They're very sturdy. And here's a great example of a synovial joint. A synovial joint has a sac all the way around it that actually has pressure inside it. So hopefully this bone doesn't hit this bone. This is your elbow, by the way. That's a synovial joint. Synovial joints are full of synovial fluid. What's synovial fluid, Tapscott? It's the oil of your joints. That's it. It's created by the membrane around there. It's kind of cool. The sac around there creates the very fluid it needs to create. Think about it this way. If I rub my hands together like this for a long period of time, like my lifetime, right? My fingers are going to bleed. Like, that's friction there, right? Well, if I put a plastic bag over this hand and a plastic bag over this hand and put oil on the bags and rub them together, I bet I could rub them together forever. That's how your joints are. They have a baggie kind of over this one and a baggie over this one and oil in the middle, and they just slide around all day long. That's exactly what a synovial joint is. Except it's not really a baggie. Synovial membrane, it's amazing. But you get the idea. Yeah? Beautiful, beautiful picture of a synovial joint. Just want to show it to you. I just want you to kind of visualize it. I don't care if you memorize all this stuff. Fact is, there is a hollow area inside that's full of synovial fluid. This stuff is almost like ligaments around the outside. The synovial membrane is really, really hard. And this is articular cartilage, which is cartilage that kind of helps in case the bones do hit. You've got some really slick stuff there to kind of protect them. That's it. Easy peasy. So one of the reasons, by the way, these swell when you get them hurt is your body's actually trying to pump more fluid in here to get them to clean out all the debris and bring more blood into them. Swelling in general is actually a good thing. You should know what Bursi sacs are, but I'm going to show you a better picture. Here we go. Bursi sacs are synovial membranes without a joint. They're this little balloon thing that was this synovial joint here without a joint here. And what's this guy doing here? He's helping muscles slide over your bone so that you don't pinch them all the time. Can they get irritated? Yes. Anything with the word itis on the end, means inflamed. Bursitis is an inflamed bursi sac. Tendinitis is an inflamed tendon. Ligamentitis is an inflamed tendon. Tapscottitis is an inflamed tapscot. All the time. Itis, itis, itis. Yes, itis means inflammation. You can put on the end of anything. That is important, by the way, because somebody will come in with some really weird thing. They'll be like, blah, 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 itis. And all of a sudden you'll be like, oh yeah, tapscot, you've got inflammation of this thing, right? Because they throw it on the end of everything. And sometimes it's vague stuff that you haven't heard about in a while. But anyway, it's itis. Itis means inflammation. Itis at the end of a word means inflammation. Miss Tops, what does itis mean?
Itis at the end of any word means inflammation.
I love that. Thank you for repeating exactly what I said. Thank you, Miss Tops. Miss Ramirez, what does itis mean?
Itis?
Itis. Itis.
I know you just said it.
It's okay. I don't want to get really inflamed because you can't answer. Boy.
Wait, I know you just said it. Flame, right?
Yeah, inflamed.
Yeah.
So what does itis mean?
Flame?
Inflamed, yeah. Yeah. Swollen and hot. Inflamed. Yeah. So what do you suppose tendinitis is?
I know it's when your bone or
No.
your...
What do you suppose
Oh,
tendinitis is?
tendon?
Yeah.
Tendon? Oh, yeah.
It is tendon, but what is tendinitis? If itis means inflamed, and you know what a tendon is, and you know what inflamed is, what's tendinitis?
Inflammation? No.
Inflammation of the what?
The tendon?
Yes! Thank you. What's ligamentitis? What's ligamentitis?
It's not blood, right? No.
It's inflammation of the what? What's ligamentitis? Yeah, go ahead, say it.
Inflammation
Of the...
of the... How do you say the word again?
ligament.
Right? Ligament?
Yeah.
Yes. Inflammation of the ligament?
Yeah. What's bursitis? Don't overthink these.
Inflammation of the... Like... Inflammation?
Of the... It's bursitis.
Bursitis.
Yeah, so inflammation of the what?
Bursitis.
How about bursa?
If,
Yeah, all I'm doing is this, and you're helping me teach everybody, so I appreciate it. Thank you for being patient. I know it's embarrassing, teachers calling on you, and you're going over this, you're like, I don't know the answer. That's okay. That's why you're in school. That's why I have a job. But tendinitis is the same as saying tendon, inflamed, or inflamed tendon. Ligamentis is the same as saying ligament, inflamed, or inflamed ligament. Bursitis is the same thing as saying inflamed bursa, really. It's that simple. Yes. What's Miss Ramirez-itis? In fact, yeah. Inflamed what?
inflammation I guess for minutes?
Yeah. Yesterday, Miss Ramirez had tummy-itis.
Inflammation in the tummy?
Yeah. That's it. That's all it means. Anything you put it on, just like, oh, that's inflamed. Yeah.
Okay, I see.
Cool. Thank you, ma'am.
Thank you.
Miss Smith. Yes, ma'am.
Sorry, I was going to ask this a little bit ago.
No.
I cannot remember what it's called, but the band that goes around the joints and like the elbow and the ankle.
Yeah.
What is that?
Retinaculum.
Retinaculum. And what is that compared to, like, I know this is a ball and socket joint, but like, can we see that band?
You can.
Or are we just seeing like the synovial spaces, like where
Right.
the fluid goes?
Well, there's not retinaculum around your shoulders,
right.
so you wouldn't see it there. But it's not part of the synovial membrane, and you can feel it. I'm not very good at it, but I know a lot of massage therapists can. But anyway, it's superficial enough that you can feel it. It's just underneath the skin. Retinaculum is a ribbon-like fascia, and quite literally, you know when gymnasts wrap up their wrists and stuff and their ankles? It is literally a connective tissue wrapping underneath your skin.
Okay.
In fact, they're just giving themselves extra retinaculum. That's what they're doing. And it is underneath the skin, and some people can feel it kind of move around a little bit, especially in the ankles. You can sometimes feel it move. It's a very thin kind of wrapping around there, and it's superficial fascia essentially, but it's in ribbon-like bands, and it's meant to give extra support to ankles and wrists. Yeah, and that's a good thing to know. Retinaculum is a good thing to know. What?
It's only in the ankles and the wrists. It's not in the elbows.
I don't think it's in the elbows.
Okay.
Yeah, you got a lot of ligaments in the elbows. You got a lot of ligaments everywhere, by the way. This shoulder picture right here would have, I don't know, 20 extra ligaments all going all around it to hold it together. But no, I don't think there's retinaculum that I can think of anywhere else except
Well, thank
wrists
you.
and ankles. Thank you. Good question. Okay. What was important from the skeletal system review is your actions. I'm going to perform an action and have people tell me what it is, and then we'll take a break. Actually, maybe we should take a break first. So, let's do that. All right, everybody, let's be back at 9:11. I look forward to seeing you there. Be there, be square. See you soon. 9:11. down only. 9/11. And we are back with Happy Tappy. So this next section in your massage therapy book also ties into your trail guide book. And it's actions, right? It's actions. How important are actions to kinesiology? Well, you can't have kinesiology without actions. So do I think this is important material? Yes, this is important material. Knowing your actions is really, really important because later we can't discuss movements if you don't have them down. And so this is the time. So let's review actions. Let's call on some people. Let's see if we've got our actions, things like that. Let's talk first about flexions and extensions. Flexions and extensions usually happen in what's called the sagittal plane. That's the plane that divides me side to side. I know it sounds weird, but my arm is swinging in the sagittal plane. Not the mid-sagittal plane, but the sagittal plane. It is swinging in the sagittal plane, meaning that plane would cut through my arm this entire way. Flexions and extensions tend to happen in front of me and behind me. In fact, if you're in anatomical position, they always happen either in front of you or behind you. Always. Okay? So when you see movements where I am doing stuff like this, these are all flexions or extensions that you can be sure of. And depending on how you measure it, flexions are a closing down of an angle. Flexing, the angle is getting smaller. Extensions are the opening of an angle. Flexions usually happen in front, but not always. There are some glaring exceptions. But it's the closing down. So there's an angle here, and I'm closing it down right now, which means I am flexing my cervical vertebrae, my neck. Boom. Cool? If I'm opening that up, I'm extending it. So when in doubt, by the way, too, if it's moving to the front, it's a flexion. When in doubt. But look and see what angle's closing down. Right? So, if I'm closing down my fingertips, that's a flexion. That's a flexion. That's a flexion. Yeah? Flexion, 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 flexion. Cool? Okay, Mr. Penrod. Sir, let's see how you're doing with this. Sir, can you see me?
Yes.
Good. Can you even see my hands?
Yeah.
Okay. Tell me what I'm doing now.
You're flexing your fingers.
Good. Good enough for me. What am I doing now?
Flexing your wrist.
Thank you. What am I doing now?
Flexing your elbow.
Yeah. What am I doing now?
Flexing your DH joint.
I love that. My glenohumeral joint. What am I doing now?
Flexing your neck.
Yep. What am I doing now?
Flexing your hips.
Yes. Thank you. What am I doing now?
Elevating. Wait, now you're extending your hips.
Flexing my hips still.
Oh.
I know. I did it on purpose, by the way. To my hip joint, there's nothing different between this and this. The joint's doing the same thing. It's weird to think about it that way. I realize in gravity there's something different. But there's nothing different than this and this to my elbow joint. The elbow joint still closes. Does that make sense? Anyway,
Yeah.
Good job, sir. Thank you. Well done. Mr. Penrod did an excellent job of identifying 13 different types of flexion. Yeah? Yeah. I love it. Miss Juntapone. Hi.
Hi.
So, Miss Juntapone, you don't even have to tell me. I don't even need to know what joint is doing. I just want to know if I'm doing a flexion or an extension. Just tell me either flexion or extension, okay?
Okay.
Okay.
Flexion.
Well, hold on. I'm not doing anything yet. All right. Now what am I doing?
Extension.
Yes. Now what am I doing?
Extension.
Yes. Now what am I doing?
Extension.
Yes. Now what am I doing?
Extension.
Thank you. Well done. Excellent. By the way, we all caught the mistake. You did great, by the way, Mr. Juntapone. But the mistake she made in the beginning was I was in a position that I had to do a flexion to get to, but I wasn't doing anything, right? Remember that? Remember that about movements? Right now, you would say, oh, that's a flexion of the elbow. No, it's not. It's just a dude hanging his arm here. That's all it is. There's nothing happening. Because the minute I start going here, it becomes an extension, and the minute I start coming back down here, it's a flexion. It doesn't matter where it is or whatever. You can't tell until there's movement. Really well done, though. Really well done. Okay. Abductions and abductions. You just said the same thing. Abductions and adductions, adductions, always happen out to the side. Always. Always. They happen in what we call the frontal plane, but I don't even really care about that. But they're jumping jacks. Okay? That's it. And abductions are moving away from the midline. And add, just like when you're adding numbers, is adding things back. That's it. So if I'm moving away, I am abducting. If I'm moving back, I am adducting. That's it. Yeah? Good. Mr. Kachekian. Sir.
Yes, sir.
Okay, sir. What am I doing now?
Abduction.
Abduction. I'm moving away. What am I doing now, sir?
Adduction.
Adduction. I love the way you said it. What am I doing now?
Abduction.
Yep. What am I doing now?
Adduction.
Yeah. This also works with your hands. What am I doing now?
Abduction.
Which one?
Abduction.
Abduction. Moving away. We count this as the midline, everybody, by the way, when we get to hands. And what am I doing now?
Adduction.
Adduction. Yeah. That's it. I just froze. Wow. Anyway, excellently done, sir. Thank you, thank you, thank you.
Thank you, sir.
Thank you. Miss Mitchell?
Yeah.
Miss Mitchell, what am I doing now?
Abduction.
Yeah. And guys, I realize it's coming back in here, but we still count this as abduction all the way up because it's getting further, my hand is getting further way out here. And what am I doing now?
Adduction.
Adduction. Okay, and now this next part is not fair, but I'm going to give it to you anyway. The answer is not abduction here. What am I doing now? This one's...
Flexion.
It is. It's called a lateral flexion. It pisses me off, but it's called... It's because my head can't really get away. I realize it's going over here, but it can't really get away from the midline. And so they're just saying you're bending laterally. And so, yes, limbs can do abductions and adductions. Limbs can do abductions and adductions. Your torso, your axial skeletal system does lateral flexions. This is a lateral flexion. That's a lateral flexion. Yeah? Does that make sense? By the way, guys, that's also true here. This is a lateral flexion of my spine. It's not an abduction. Because this is my midpoint, so I haven't really taken myself away from my midpoint. I'm laterally flexing. You don't really like that, but that's the way it works. Thank you. Good job. Yes. Okay. That's abductions, extensions, flexions, all that good stuff. Boom, boom, boom. We also sometimes have movements where we're already out horizontally. My hands are horizontal. But they can still move towards the midline. I can still add them back in, so we call this a horizontal adduction. And we call this a horizontal abduction, moving away from the midline, yeah? Yeah. Miss Kilpatrick.
Yes.
Miss Kilpatrick, what am I doing right now? Besides freezing.
Deep.
Yeah, go ahead.
Adduction.
Adduction, a horizontal adduction. So what am I doing now?
Ab.
Yes, a horizontal abduction. Thank you, ma'am. Some of the other stuff that we don't use as often but is important to remember. I can adduct here. I mean, I can pull my fingers together. But there is a really interesting thing your hands can do that very few primates can do, actually. And that is I can cross over like this. And we call this opposition. And it's actually pretty important. Your thumb is really good at it. Your pinky's kind of good at it. And we call it opposition. It's actually opposing and going over everything. It's what allows you to grab tools. It's really your ability to grab stuff in some ways. I know this is a flexion, but your thumb can it can actually come over if it wants to, and that's an opposition. Opposition is important to remember. This is opposition, when your thumb touches your pinky, or is trying to. Opposition, yeah. Mr. Notgen, sir, what am I, I'm trying to find you. Hello, what am I doing here? What have I done to get here?
Moving your pinky and thumb together.
Yeah, what do we call that?
Flexion.
Nope. Were you watching me or something else? I was asking an honest question. I asked if you were watching me or something else.
Oh, I was thinking that there was some bank stuff I was taking care of in the background.
Aha, that's what I thought, buddy. All right, when I cross my thumb and finger over, it's called opposition. So what's this called?
Opposition.
Opposition. Thank you, sir. I'll make sure to call on you a lot just to check in on you. I know you'll appreciate that. All right. That's opposition. Now, there is the stuff your feet does, and I don't like it because they call both movements up and down flexions. But if you think about it, if I plant my toes on the floor as hard as I can, I would actually lift up on my tippy toes. So if I plant my toes as hard as I can, I actually start to lift up. So when you are doing a calf raise, when you are standing up on your tippy toes to get something out of a cabinet, that is a plantar flexion. You are pushing the plantar region of your foot into the floor as hard as possible. That is a plantar region. That is plantar flexion, sorry. When you are lifting your foot up, it's called a dorsiflexion, and it's actually how you stop a door sometimes. You actually kind of pull up your foot. Boom. You actually pull your foot up. You're pulling up the dorsal part of your foot. That's why it's called a dorsiflexion. The top of your foot is called the dorsal region, and you're pulling it up. So if you push down the plantar region, it's a plantar flexion. If you lift up the dorsal region, it's called a dorsiflexion. The dorsal area is closing closer. That's what they mean. You know, flexions are closing an angle. You don't have to worry about all this. You can just memorize it. But dorsal flexions are closing an angle. And so when the dorsal region gets closer, you're closing this angle. And that's why it's a dorsal flexion. When you plant down, it's called a plantar flexion because the plantar area is getting closer to the leg and closing that angle. That's why they say it that way. And it's important to know what plantar and dorsiflexions are. Yeah? Yeah. I love that. Okay. Ms. Magruder?
Yes.
You probably can't see me, but I'm going to stand up on my tippy toes. What kind of action am I doing to stand up on my tippy toes?
Plant. Ooh.
You said it. Say it.
Yeah, I'm trying to.
Okay. Do you want me to say it with you?
Plantar flexion.
Yeah. Now say it like you mean it, because that was perfect.
Plantar flexion.
Yeah.
Plantar flexion.
Good. Say it one more time.
Plantar flexion.
Thank you, madam. Thank you. That was perfect. By the way, that's a good thing to do with yourselves. If you do say something right, say it again with confidence so your brain remembers you remembering it. Otherwise, it remembers you kind of guessing yourself. That's why I was doing that. Thank you, Ms. Magruder, and you did perfect the first time. That was awesome. Mr. Notgen, I'm standing up on my tippy toes. What's that called?
Dorsiflexion.
What is it called?
Or plantar flexion.
It's plantar flexion. Thank you, sir. Thank you, thank you. All right. Then the other stuff. Oh. Remember we had this crazy thing where you're just throwing your arm around like this? Anybody know what that's called? Because it's really flexing, extending. There's a little bit of abducting and adducting occurring. I'm sorry. What was that, Miss Cuppage?
Circumduction.
Circumduction. Yes. So, Miss Cuppage, What am I doing here?
You are rotating.
No.
You are circumducting.
Yes. What am I doing here?
You are
You just said it.
lateral flexing.
Nope,
No.
that's this.
You're rotating.
Yes.
You're rotating.
Ms. Cupich, thank you. I appreciate it. I'm just trying to make it. You're right. They're weird distinctions. But this
So do those two again, please.
No, I will
That's
not.
what
I will not rotate for you again. I will not do it. Okay. Yes, I will flex and extend for you again. No, I will not rotate for you again. And boy, is it a crazy day to circumduct again.
Okay.
When I circumduct, I'm actually laterally flexing, extending, laterally flexing, flexing. I'm doing all, circumducting means you're doing a whole bunch of crap at once. They didn't have another name for it. But it was a good distinction to make, right?
Yeah.
Rotating is about an axis. So this is rotation. Yes, it is. This is lateral flexion. This is flexion, extension. This is rotation. This is circumduction. Yeah.
So rotating like your whole axial. I guess it's both.
Yeah.
Like in golf. In golf, you're like rotating your whole entire torso, but you're keeping your head steady. But that's rotation, right?
It is rotation. There's a lot of other stuff going on there, but it is rotation. There's a rotation of your vertebral column, yes. A really good golfer can get a tremendous amount of rotation. Yeah. Golf swings are actually really interesting to look at because they involve almost every single muscle of your body. Yeah. Mr. Bigelow, yes, sir.
So, like, if you were, like, rotating your wrist, is that rotation, your wrist and your ankles? Is that movement rotation?
No. So my wrist actually, if you think about it, if I hold my two arm bones solid, my wrist actually can't rotate. I can rotate my arm. We call this pronation and supination. But my wrist doesn't rotate. Now my wrist can what? What is my wrist doing now?
Circumvent?
Circumducting.
Circumduction, yeah.
Yeah. So it can circumduct. And the reason it can do that is it's mixing its flexions and lateral flexions and extensions all together. And it's got a lot of joints in there. You got 8 carpal bones in there. So it can do a circumduction. But it actually can't rotate on its own little axis. There's no axis. If you really hold your two arm bones solid, I can't get any rotation here. You'll feel yourself actually trying to rotate your arm instead. You can circumduct. That's different though. That's not this. Does that make sense?
Yeah.
I can also, by the way, just like your thumb, I can circumduct my thumb. I can't actually rotate it. You can't make your thumb kind of point over here and then point over there. You can't get it to rotate. Whereas I can get my face to point over there. I can't get my thumb, I can get my thumb to go over there, but can you get it to turn over there? I can't get it to turn. I had to turn my hand.
What other body parts besides your head can perform rotation?
Very good question. Thank you, sir. Your vertebral
Like
column.
your trunk?
Yeah, your trunk. Your vertebral column. So when you do twist and shout, you know, come on, baby, let's do the twist. There is some vertebral column twisting in there. It doesn't actually twist that much, believe it or not, but each of your vertebrae don't move that much, but you got 24 of them together, and if you do it, yeah, you'll twist. You can twist your vertebral column. And if you think about it, me turning my head is really twisting my vertebral column of my neck. So really, rotations only happen, really, I'm trying to think of an example, but really basically only happen on the vertebral column. Neck and torso, yes. Miss Cupich, yes.
So when you did move your thumb that way,
Yeah.
is that considered adduction and abduction away from your, or what do you consider that
I
movement?
hate that you asked this question, even though it's a really good one. Thumb movements are a pain in the butt. So you have to imagine somebody's in anatomical position, and we remember we're going to pretend like this is the midline. Believe it or not, this is abduction, just moving it next to my hand. This is adduction. This is abduction. This is, God, I got to think about this for a second. You're hurting my brain. This is like extension when it's opening up, flexion when it's coming to the hand, opposition when it's going over. Yeah, thumbs are kind of tricky.
So when they talk about the ellipsoidal articulation, and that's in the wrists and in the ankles, it's kind of like a
Well, yeah, go ahead.
combination. Is that correct?
Wrist is considered ankle. No, wrist is considered gliding joints, but it doesn't matter.
So what's the ellipsoidal then?
The ellipsoidal is in your thumb.
Oh,
Oh, there's
your
a
thumb?
saddle. Sorry, hold on. There's a saddle joint in your thumb. Ellipsoidal. Would that be? Is ellipsoidal lower thumb? I honestly don't know. I know that was a lame teacher answer.
I thought it was wrists and ankles because it's kind of like
Well,
they can do circumflexion,
Your ankles.
not completely. It's a little bit more limited.
Yeah, but well, your wrists you might be able to argue are ellipsoidal, which just means they're little round ellipses kind of thing. I thought they were just called gliding joints, but I'm not against the ellipsoidal thing. Hold on. Hold on. Now I want to know. Sorry, because I should know this off the top of my head. Hold on. I'll tell you in 2 seconds. I'm going to feel like an idiot. Well, this one's pretty important. So give me an example of ellipsoidal joint. Sorry, I was just looking it up on the internet. What I wanted was an example of it. Well, they say they're in the wrist joints too. Yeah. Yeah. Between knuckles, wrist joints, and yeah, all your hand joints, it sounds like, are ellipsoidal joints. And the reason they call them ellipsoidal joints is they have a little bit of side movement. That's really stretching it personally. But I would agree with the wrist, that they're these little joints that slide by. Whether ellipsoidal or sliding, ellipsoidal joints or sliding joints just do this. They just kind of slide around on each other. And they're wrapped up in fascia so they don't slide too far, but they just slide. And if you have enough stuff that can slide, you can kind of get little movements in there. Hope that was a halfway decent answer.
That's
Yeah.
good.
Good. Okay. Good, because I made it up. Okay. Where was oh, Miss Mitchell. No, sorry, Miss Mitchell. I've called on you already, and I gave you a nasty question last time. Miss Zwick, yes, ma'am.
Don't your shoulders and hips also rotate?
Yes, they do.
Like,
Yes, they do. Sorry, they do medial and lateral rotations. Miss Zwick's right. Miss Zwick's right, and I'm wrong. So it's not just your head and neck and your vertebral column that rotate. Your shoulders and hips do rotate. They rotate in the socket. That's why I'm able to get medial and lateral rotations. She's exactly right. That's one other place you get a rotation, where it's literally hanging down here and it can rotate in the socket because it's a ball and socket. Yes, ma'am. She's right. That's it, though. That's where I draw the line of rotations. So in the vertebral column, whether it's my head, my body, but she's right, my hips and my shoulders actually have the ability to rotate. That's where we get medial and lateral rotations. This is not happening at my elbow. This is happening at my shoulder because my shoulder is able to twist in its socket. And that is rotation. Thank you, ma'am. Mr. McClure. Sir?
Yeah, buddy.
Can you describe some of the movements I'm doing here to kind of bring some clarity to all this stuff? So we kind of went over this with Miss Cuppage, but I am doing what? This is all going to be with my neck. I am doing what now?
Flexion.
Yes, closing an angle in front. Thank you. I am doing what now?
Extension.
Cool. I'm doing what now?
Lateral flexion.
Yep, I'm doing what now?
Lateral flexion.
Yep, and if we had to describe this, guys, we describe it as lateral flexion to the left side because it's my left side. It's always the client. Just to let you know. I am doing what now?
Rotation.
Yes, I am doing what now?
Circumvention.
Awesome. Thank you, thank you. Cool. Awesome. Mr. Notchin. It's going to come as a surprise to you, but I'm going to ask you all this too. Sir, what am I doing now?
Looking down.
Yes, I am looking down, but what do we call that?
Flexion forward.
Yes, you can could just say flexion, but you are correct, sir. Thank you. Flexion. So if this is flexion, what am I doing now?
Extension.
Yes. What am I doing now?
Lateral rotation.
But there's no rotation. Lateral what? F.
Lateral flexion.
Lateral flexion. So what am I doing now?
Lateral flexion.
Yes, sir. What am I doing now? Wait, I'm frozen, I know. There we go.
Lateral rotation.
Just rotation. Yep. And last but not least, what am I doing now?
Circumvention.
Yes, circumduction. Thank you, sir. Okay, moving right along. The only other thing I can think of is a couple other things. If I am turning my hands up like this, everybody, as though I'm holding 2 cups of soup, this is supination. Oh, what a nice way to remember that, Tapscott. Yes. As I turn them down like this, I am prone to dump out my soup. And this is called pronation. Supination, pronation. I don't actually have to be here, but as I head towards holding a bowl of soup, I am supinating. As I start to dump out my bowl of soup, I am prone to dumping out. I'm pronating. Yeah? Yes. Okay. Miss Lopez Moreno. Hello.
No,
Miss Lopez Moreno, what am I doing now?
you are doing supination.
Yeah, thank you, ma'am. And what am I doing now?
You are doing pronation.
Thank you, ma'am. Awesome. Well said. We also have elevation and depression. We tend to use those with the jaw, the shoulders, and the hips. Yes, Miss Tops. Yes, ma'am.
So supination and pronation are only used with the hands. Is that correct?
Usually. Some people use them to describe the feet. And let me explain why. Your feet, I don't know how well you can see me, but your feet can do what's called an inversion, where you're walking on the outside of your feet and the soles are pointed in, and they can do what's called an eversion. So they can do an inversion where they're kind of pointed like this. Some of us walk, it's not a big deal, by the way. All of us walk in a different way. Some of us walk on the outside of our feet, some of us walk on the inside of our feet, some of us walk completely, perfectly flat. It's unusual. Anyway, as my soles kind of point in, that's called inversion. As they point out, that's called eversion. And we care about it because it can affect hips and things like that. But some people call this supinating or pronating of the feet. I wouldn't worry about it because I rarely ever hear people talk about it that way. They usually only use supination and pronation for the hands. To answer your question in short, I just want to give you the complete answer. It can be used when talking about feet, but usually we only use supination and pronation for the hands, and for feet we use inversion and eversion. Yeah. So a foot can plantar flex, dorsiflex, invert, evert. And I remember the inversion, my soles, my feet are starting to look at each other. Evert, they're starting to look away from each other. Yeah. Thank you. That was a really good question. And then we have elevation and depression. Elevation and depression was, elevate just means like an elevator to go up. I realize elevators can go down, but we think about them going up, right? So elevator to go up, just, oh man, my jaw, now I can't talk until I depress it again. Then I can talk. Let it go back down again. Elevation of the shoulders. We look for this in clients. We especially look for people that are unevenly elevated. And we even look at it in the hips. We actually look for if somebody's hips are hiked up on one side. This is an elevation of my left hip. Now it's kind of causing me to do a lateral flexion. I get that too to stay on balance, but my left hip is elevated over my right hip. And we care about stuff like that because obviously if your hips, if anything's skitty-wampus, that's a technical term. If anything's skitty-wampus with your hips, your spine is screwed. That's a technical term too. Because your hips hold your sacrum, and that is the foundation for your spine. And so if they do this, your spine has to do something. You don't go walking around like this. Your spine tries to curve and get back over your hips. So anytime the hips rotate, move, elevate, whatever, your spine has to adjust for that. And that's a big deal. And so if you have people with back troubles, you should be looking at their hips. I'm not saying it's 100% of the time that's going to be the case, but you should always be looking at their hips. Quite often that's a lot of the problem. And if there's a problem with the hips, there could be a problem with the feet. Because the feet are screwed up, the hips are going to be screwed up. And if the hips are screwed up, the back's going to be screwed up. And the back's going to be screwed up, the neck's going to be screwed up. And they often come in and complain about their neck. But they have a foot problem. Yes, Ms. Govich.
So in those, and I'm sure we're going to learn about it later, but in those situations when somebody says, my back really hurts, I just want you to rub my back, you're like, well, would you tell them that it could be hip issues? Can I work on your hips too? Or do you just like let them run the show?
I let them think they're running the show. So, this is a great question. It's a great question for a lot of reasons. Because there's what we teach you in massage school, and then the fact that you have to go out and make money with it, right? And essentially the customer's always right. Essentially, if a customer wants me to do anything that doesn't violate my boundaries or theirs, isn't illegal or unethical, I'll do it. If you want me to rub your little pinky for an hour and it doesn't seem like it's going to harm you, and you want to pay me $100 an hour to do it, I will do that. But I would suggest to them. What I do is I always start working on the problem spot that they're complaining about first thing. Because they come in and they're like, oh, my neck's killing me. I'm so glad to see you today, right? And I'm like, yep. And I start working on that neck and I go, hey, this neck thing could be related to your back. So I know you said to spend the whole massage on your neck, because some people do that. But could we take a little look at your back and see how it connects to your neck? Well, how do you know that's true? I don't. I tell them that right out. I don't. But it's very common, and I see some tension here that could suggest that that's the case. People would respect that even more. They're like, oh, wow. Like, you're just saying it's a possibility, and you're already kind of looking. And then literally, if they're like, nope, I just want you to work on my neck. I've had clients do that. Okay. I recommended a better course of action, I think. But you know what? I get paid the same. It's not doing you any damage. Like, that's fine. Most people, though, are like, yeah, that's cool. I didn't even think about that. And a lot of times you'll be like, and then can we take a look at your hips? Because they seem a little bit off, and I think that might be affecting your neck. You always say it very gently. Don't be like, your hips are screwed up, because then people feel, you know what I mean? But just be like, one side seems a little elevated. You know? And they're like, oh, nobody's even mentioned that. Well, a lot of therapists aren't structural therapists. You say something smug like that. You know. A lot of therapists weren't trained at Gateway Community College, but I was, so I look for stuff like that. But anyway, you know, if you don't want to work on it, it's fine, whatever. And the reason too, they'll be like, well, why work on my back? Well, I think it'll give you longer relief to your neck. That's the point. You can rub any spot and pretty much make it feel better for that day, but it comes back very quickly. And so we're trying to make it feel better for a longer period of time, which you would think would be bad for business, but it's actually very good for business. Yeah. Okay. Yeah? So, we just went through integumentary system, skeletal system, and a whole bunch of movements that just happen to fall in there, which I think are extremely important to go through. Extremely important. Because when we talk about muscular actions, they mean nothing if you don't know what extensions, flexions, rotations, all that stuff is. Yeah? Cool, cool, cool. Okay. Mr. Kachekian, I'm so sorry. You have your hand up.
No worries. When you see somebody with like an extended hip, like it's extended upwards, how do you go about like the therapy to help that? Or you can't really do anything, you just kind of help it to help relax the muscles and tendons of there? Or do you do something specific to help that area?
The short answer is yes. You can do all sorts of stuff. Let me give you a slightly longer answer. I don't quite know what you were describing, but you kind of saved me because I really should talk about hip positioning. So, remember with the shoulder blade, we chose to pick the acromion process and say when this moves up, we'll say it rotates up. I'm not talking about elevating. I'm talking about when it rotates. We said we're going to talk about the acromion process because actually, when the acromion process goes down, up, the superior angle goes down. Superior angle goes up, the acromion process goes down. Anytime there's a wheel, it's very hard to describe what it's doing. So we pick a spot on the wheel, we pick Mr. Tapscott's ring, and we say when the ring goes up, we're going to call that an upward rotation. When the ring goes down, we're going to call that a downward rotation. We just pick a spot. Well, we have to do the same thing with the hips. The hips actually kind of rotate here. So not rotations like we were talking about, everybody. But we pick the top of the hips. And we say when the top of the hips start to go back, it's a posterior tilt. Posterior tilts tend to look like this. They're really tucked, their butt's tucked way under. Anterior tilts, the tip goes forward, and believe it or not, that makes you get this kind of thing where you stick your butt out. Because as the top goes forward, the bottom goes back. Literally the bottom in this case. So I think you were talking about an anterior or posterior tilt. The other thing you can have with hips is one side is elevated.
Yeah, that's what I meant. Like if one side is elevated.
Okay. Well, whether you have one side elevated or an anterior or posterior tilt, yes, there are things you can do. You're looking for the muscles that would create those problems and be shortened and trying to lengthen those. So you would look for, well, what muscles can hike up my hip? So this is a very simple answer, and there's more to this answer, but this will use your anatomy that you guys already have a little bit of. What, Mr. Kachekian, are the 5 abdominal muscles? This is very hard to do because I'm pulling it out of the blue. But do you remember the 5 abdominal muscles? You've got a rectus. Oh, you're muted, sir.
Rectus abdominis.
Rectus abdominis, a
transverse abdominis.
Yep, you've got an external
oblique
and an internal
oblique.
And what back here?
The quadratus femoris. No,
Quadratus
sorry.
lumborum.
Lumborum. Sorry.
No, don't be sorry. It's really hard to do when somebody pulls it out of the blue. And we know muscles can only do one thing. What's that one thing? Thank you, Miss Langford. They can only contract. So even without knowing this, if I have a muscle between my hip and my back here, and it can only contract, what do you suppose happens if the quadratus lumborum contracts unilaterally?
Brings the whole back.
Brings the hip up. In fact, the quadratus lumborum is actually nicknamed the hip hiker. You actually use it to rock your hips up and down. So if the quadratus lumborum was tight on one side, that would give you an elevated hip. Could other things do it? Yes, they could. But it'd be one of the first places you'd look.
Okay, thank you.
Yeah, that was just a great, I mean, we need more detail in this answer later, sir, when we get to this, but it just gives you a great example why anatomy is important. So I really appreciate the question. And it really is one of the first things I look for. If I saw somebody coming in, they're like this, the QL's got to be tightened up on that side. Now, there might be other problems in here, abdominal problems. They might be trying to get away from pain on the other side. There's lots of stuff we might have to learn. They might just have one leg longer than the other. But that's not that uncommon. But the point is, it's one of the things I would look for. And when you go, and by look for, I just mean when I'm rubbing their back, I'd be like, oh my gosh, that left side is really tight there. Maybe I shall rub it more and get the hip to come back down. So yes. Anyway, sir, yes, you can affect pelvic tilt, anterior and posterior, and elevation. And you want to. A really good massage therapist does that. Just like if you're having building problems, I would definitely want somebody to consider looking at the foundation before just, fixing the thing up on top that seems to be the problem. Yes. Miss Smith.
So just because you mentioned tightness, so
Oh, that's
how
right.
quickly...
You got the back. I forgot. Yes.
Yeah, I do. How quickly after or like during a massage, when you're massaging a tight muscle, will that muscle start to relax? Like, is it going to have immediate effects or is it going to take days?
No. Sometimes you'll have fairly immediate effects. Sometimes within that hour during the session. Like, you can often rub a muscle and feel it just relaxing. And that's an immediate effect, basically. Stretching might take time over time to create an elongated muscle, just like stretching takes time in the real world, you know what I mean? But no, you can see some immediate effects. Like, you'll have clients come in like this sometimes. I know this isn't a hip. And they'll walk out of the session like this. I mean, that's dramatic, right? And that's just 1 hour. So yeah, no, you will see that sometimes where you've really loosened up the muscle and it really is looser and it's back elongated again, and all of a sudden this person that was like this is all of a sudden like that. So it can be pretty
And,
immediate.
What
What now?
I'm sorry. And then like the retype they're doing throughout their day, like I can't say, okay, you're gonna be like this will be loose now for the next week. Like come see me in a week. We can't really say because if they're like going out and doing the exact same thing that they've been doing.
So Ms. Smith's just touched on something extremely important to therapy and extremely important to marketing and all sorts of stuff about how you talk to your clients. So what I often tell my clients is they're like, yeah, my shoulder was great after I left here, and then in a couple days it's bad again. You know, when is it going to get better? And I go, well, I get an hour a week with you, and you get all week long to go screw up my work again. And I laugh when I say it. You know what I mean? You have to have a good rapport with your clients. Be very careful when you phrase that. But a lot of stuff sounds better with a laugh. So I'm like, well, Miss Smith, I only get you for an hour a week, and sure, we do a lot of progress, but then you go back out there and screw it up again. If you do the homework I recommended, which was for you to do those stretches in between, that would help keep that muscle elongated in between sessions. The other thing is you could come see me more often, and people always ask, well, how often should I see you? The answer is, I always tell them every single time is as often as you can afford. Because you almost can't do too much massage. Now don't get me wrong, you shouldn't massage an area that's sore from the massage you gave it. So if I do deep tissue on an area and I've really beat you up and it's sore from the massage I gave, I should not go to deep tissue on that area again until it's better. But essentially, I at the resort, we'd have people come in there on vacation, I'd massage them every single day. So if somebody comes to me with a problem and they ask me what's the best kind of course of action, I often say, please come to me 3 times the first week, right? Monday, Wednesday, Friday. And then maybe twice the next week. And then maybe once the week after that, and then once a week for 4 weeks, and then maybe once a month, and we'll see if we can kind of knock this out kind of thing. But it's with really bad stuff, sometimes you're trying to retrain muscle that they've been messing up for 50 years. It'd be nice to see them 3 times a week for 4 weeks, then twice a week for another 4 weeks, then once a week for another 4 weeks, and then down to maintenance for a month. That's not uncommon. So, but again, I always tell them we're trying to retrain your muscle. That takes time. And just like you said, Ms. Smith, they go back out and screw it back up again. And so we very nicely want to say that, you know, but that's why it's good for them to stretch, relax. A lot of people are like, what should I do after this massage? I'm like, go home, go to sleep. It'd be the best thing you could do. Because you're loose now and everything's good. Go home and have the muscles remember that. Go home, go to sleep. You know, I'm often like, I'm the only massage therapist that massage therapists like, drink lots of water, and yes, they should, but I'm like, go home and have a glass of wine, go to sleep. It's fine. It's okay, guys. It won't kill you. I know everybody's like, oh my God. Go home and have a glass of wine, go to sleep. Go ahead, eat a Twinkie, whatever you're into, and go to sleep. Gosh, please. Mr. Kachekian.
Sorry to speak again, but if like you're working on a person's body, like if you're working on like their shoulder or their back, and they say it feels better, but they come back a week later and say, oh, I lifted like a 200-pound thing and I sprained my back and it hurts again. And you're like, what do you mean? And they're trying to like blame you for something like that. It's like, how did they make that connection? It's like, you lifted the heavy thing and sprained your back. And
You do it very nicely. I had this happen once at the Princess where it was not a massage I did, but it didn't matter. I was a manager there, and a guy called in and said, I got a massage, and I threw out my back because of the massage. And I was like, oh my God, that's terrible. And I said, like, when did you get your massage? And he said, yesterday. And I said, when did your back get thrown out? He said, this morning when I was putting on my shoes. And I'm like, oh, okay. Well, you also ate a steak yesterday. Did the steak throw out your back? You also walked yesterday. You swam yesterday. Did those throw out? Like, it's a far-fetched idea. I understand why they're saying it. But if it didn't happen during the massage or right after they got up off the table, it's pretty hard to push. So anyway, the way you deal with it is very kindly. You want to be very nice. You don't want to trigger people. But you're just like, I just be like, Mr. Kachekian, I completely understand how you could feel that way. And I really respect that. And we'll try to be even more careful during your massage, but there's so many other things that could have caused that. And usually when backs go out, it's been building for 25, 30 years. You know? It's like many things in our life, that the moment it happened wasn't the cause. You know, it's just like when your pipes burst in your house or something, they've been degrading for 25 years and then they finally burst. We don't really blame it on that day. And usually if you explain it to them that way, it helps.
Like if you're every day putting like an extra 80 pounds on your back or something and walking around with it.
Yeah.
It's like hard to.
Yeah. I just try to explain to them, like, lots of things in life go wrong. And we often say, oh gosh, it went wrong because that thing that happened at that moment, but usually it was really going wrong for a long time before then. Right?
Thank you.
Yeah. Thank you. Mr. Kachekian, will you do me a big favor?
Yes, sir.
Thank you. I, by the way, love how polite you are. Love it. Don't ever apologize for speaking up.
Okay.
Just speak up. I love it. Talk to me. Yell at me.
I
It's good.
just don't want to take away from anybody else.
You would never take away from anybody else. Never.
Okay, thank you.
Thank you, sir. Did somebody else raise their hand? No. Good.
It's okay.
Oh, no, it's not okay. Talk to me.
I was just saying, I love the way that you made the analogy with something totally different besides massage to help them understand versus making an analogy with massage, because sometimes they can just argue back with you with massage. Well, that didn't happen to me, but you kind of push it towards pipes, which have nothing to do with massage, but I'm trying to get my point across to you. So I just kind of take that in the game of sales when we're like selling something or like rebuttaling or whatever the case may be. That's kind of what it gave me. The mindset.
Thank you for pointing that out. And you're right, I try to. And people do this to us all the time. I'm sure I do it too, by the way. They do this thing where they're like somebody would be like, well, you pissed me off, and that's why I reacted that way. And it's like, you were full of hate and anger. I said one wrong thing, and you lost your cool. Blaming it all on me is kind of a radical concept, right? They've been building to that point, right? And health is the same way. Yeah, I mean, yes, I hurt my back. This is a true story. I hurt my back in the gym lifting weights, and I could blame it on lifting weights, but my back had been bothering me for 6 months. The reason I hurt my back in the gym was because I ignored it for 6 months. That was the cause. The cause wasn't that day. You know, people are like, oh, it's deadlifts. No, it wasn't deadlifts. Deadlifts aren't bad in and of themselves. What's bad is when you don't listen to your body for 6 months. Yeah, very much my fault. Yeah, thank you, ma'am. And I like that. You're right. Switch to a different system, not massage. Okay. Really? Well, we're about at break time again, aren't we? Yes, we are. Okay. Let's meet back here at 10:08, everybody. Thank you, thank you, thank you. 10:08. Okay, everybody. And we're back. Let's talk about the muscular system. Yeah? Yeah. Really quickly. And then we'll do muscle review if we have time, and if not, we're doing that tomorrow. That's all we're doing. Let's see here. I think we might have a little bit of time. So, bear with me. The computer's running a little slow. There we go. This is the muscular system. Again, this is in that vein of like, what do you really need to remember? And again, I'm not trying to dumb down the material. It's just that like there's only so much stuff you can pack into your brain. And I hate for you to pack in stuff, some obscure fact that you're never going to use. Let me give you an example, by the way, of an obscure fact that you're never going to use. The number of muscles in the body. Just like the number of bones in the body. How does this help you diagnose problems? No. It's great if you're on a game show, but that's it. That is, I don't care if there's 50 billion muscles in the body or 2, although it'd make this course a little easier if there was 2. But it doesn't matter. Like, it really doesn't matter. They're not even quite sure how many muscles there are in the body because it depends on how you divide them up, and they keep finding new little ones all over the place and whatever. Anyway, so I'm not trying to make fun of the book either. I'm just trying to say sometimes they, you know, and the number of bones too. It's 200 something, I don't know, whatever. Okay, so what do you need to know about muscles? Muscles can only do one thing. They can contract. Now, everybody, I feel like I need to keep re-saying this too because I'm worried that somebody's going to think that they can't uncontract. I get they can uncontract, but my point is my bicep can only pull my arm here. It can't push it back out. My bicep's done. That's it. It can relax. It's relaxed right now. It can let go. So I guess it can contract and then stop contracting. But its only job is to pull or not pull at all. And then nothing happens. My bicep doesn't push this arm back out again. My tricep has to pull it out or gravity has to pull it down. So muscles can only shorten, and this is number one in kinesiology because it lets you know about pulling, which is why the whole origin insertion thing works. Right? We know that these two ends have to come together. Muscles only pull, they only contract, they only shorten. And again, I want to be very clear because I don't want you to go someplace else and they're like, well, that's wrong. Muscles can lengthen. Yes, muscles can be lengthened, but they don't lengthen themselves. I stretch out my arm. It's not my bicep stretching itself out. I'm stretching out my bicep using other muscles. That's very different. My bicep can only contract. My everything can only contract. That's only work it can do. It's kind of like if I can only walk forward. I can only walk forward. You can push me back. I can roll back down the hill, but I can only walk up it. That's the only powerful thing I can do. Yeah? Yes. Miss Langford? Miss Langford, muscles can only do one thing. Will you be so kind as to tell us what that is?
Contract.
Thank you, ma'am. Contract. Yes, contract, which is a fancy word for shorten. Thank you. Love it. Your muscular system is made up of your skeletal muscles and the associated structures, which are tendons and aponeuroses and related fascial structures. I don't really want you to remember all that. Your muscular system is essentially made up of your skeletal muscles and tendons. Of course there's fascia in there. There's fascia everywhere. Skeletal muscles are muscles that attach to your skeleton. Are there other types of muscles, Tapscott? Yes, there are. I've got a cardiac muscle. That's not attached to my skeleton. It's my heart. And it goes beep, 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 or pa-pump, 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 or dub-lub-lub, dub-lub-lub, dub-lub-lub. Whatever it does, that is a non-skeletal muscle. And you do have muscles around like your arteries and veins and things like that. Those aren't skeletal muscles. They're actually meant to contract your arteries or open them up or your veins and whatever. It's kind of cool. So you've got muscles lots of other places. But when we're talking about the muscular system, we're normally talking about your skeletal muscles, which are muscles that attach to bone, which means they are muscles of movement and posture. They're the reason I can stand up straight right now. Those are muscles tightening and pulling on bones to make sure I kind of stand like this. And they're muscles of movement, right? Those are skeletal muscles. So the muscular system is essentially muscles and tendons. So if I asked you what the skeletal system was and said, what's the skeletal system? You'd say, it's really just muscles and tendons. You want to throw in some fascia, make yourself happy, you can, but it's muscles and tendons, Tapscott. Miss Zwick, what's the skeletal system?
Muscles and tendons and maybe some fascia. You want to throw that in?
I love that. Thank you, Miss Zwick. Couldn't have said it better myself. Yes. Mr. Ashok Ali, what is the muscular system? Are you there? Mr. Ashok Ali? Are you there? I didn't lose you, did I? We'll give you a second. I'll come back to you, sir, see if you pop back in. Maybe you just fell off for a second. Hold on one second, everybody. Mr. Bigelow! What? Wait, hold on. What was that?
It's muscles and tendons.
Ah!
My phone had glitched out.
Cool! Thank you, sir! I'm so happy. Awesome. Muscles and tendons. Well said. That simple. Saved by the bell, Mr. Bigelow. Okay.
Hey, Mr. Tapscott.
Yeah.
On the skeletal muscles, there's tendons and muscles.
Yes. Exactly.
Okay.
Thank you. Skeletal system, muscles and skeletal muscles and tendons. Yeah. Cool. Thank you. Okay. And what do muscles help us with? Posture. And the reason I have muscle tone in here is that in order to have good posture, your muscles are slightly tensing up to give you posture, right? But that's kind of obvious. Like, I have to pull on things to get myself to stand up straight. That's, you know, don't worry about any of this other stuff. Why am I showing you this picture? Is it because Tapscott wants you to memorize things like epimysium and paramysium and endomysium? No. I don't care. Endomysium is fascia wrapped around a single muscle fiber. When you put a whole bunch of those muscle fibers together, guess what? You wrap them with more fascia, which is paramysium. Same fascia. We just like to give it a new name so we can write textbooks and confuse students in anatomy class. You take a whole bunch of those bundles together and you wrap them with this fascia around the whole outside. We call that endomysium. Then you put fascia around the whole top of it. Sometimes we call that superficial fascia. This is why I'm showing you the picture. Your muscles are fascia wrapped around muscle fibers, groups of those muscle fibers wrapped with more fascia, groups of those muscle fibers wrapped with more fascia. And I would give you a great analogy because it's exactly accurate. Have you ever seen a giant electrical wire that's come in and it's big and they cross-cut it? It doesn't just have exposed wires on the inside, it's got wires wrapped in plastic too. The whole thing has got plastic around it. It's got wires wrapped in plastic, and sometimes those wires have groups of plastic around them too. That's how your muscle fibers are. And the fascia is there not just for the fun of it, it gives strength to your muscle. Muscles are very good at contracting, they're not very good at not tearing. So the fascia is like an elastic, saran-wrappy product around your muscles that keep them from tearing. Yeah. Who here likes to eat filet mignon? Okay, Ms. Smith, you raised your hand. Why do you like filet mignon, Ms. Smith? What is it about it?
I don't know. It's just really good.
Yeah. Is it really chewy and it takes a long time to bite through it and kind of gristly and...
It's because of the fat, pretty much, the marble.
Marbling, that's definitely what that, by the way, was the more culinary answer. But is it also very tender? Yes.
Yeah.
Filet mignon is very tender. By the way, your answer was much better, Ms. Smith. Filet mignon is delicious because of the fat and marbling. Any good chef will tell you that. But it's easy to chew because it doesn't have a lot of fascia in it. It's very soft. You get rump roast, which really does come from the gluteus maximus of an animal. It's got lots of fascia in it. It's a very powerful muscle, and so it's got lots of connective tissue in it. And it's really hard and chewy. In fact, the reason we cook rump roast slow and low, you'll often cook rump roast below 200 degrees for 5-6 hours sometimes. To get it tender, you're not cooking the meat to get it tender, you're breaking up the fascia. And fascia breaks down under low and slow temperatures. So, fascia is what gives structural integrity to a muscle. The actual muscle fibers are what do the pulling. Fascia doesn't pull. Fascia helps keep it together. Fascia is what gives structural integrity to your body so you don't tear so easily. And by the way, this next part is really important. Since you guys kind of got the electrical wire analogy, right, where one wire's got wrapping around it, that plastic fascia for this analogy, and a group of wires has fascia around it, and the whole thing's got fascia around it. If you pulled, in fact, if any of you have ever stripped a wire before, sometimes this happens. If you pulled all that plastic over the wire, that's a tendon. A tendon isn't actually glued onto the end of a muscle. A tendon is the fascia coming out over those muscle fibers where there's no more fibers. Tendon is really just lack of muscle. It's really the tendons there the whole way through, and there's connective tissue in the center of it, and when it disappears, all you have left is fascia. Kind of like there's a sock over my whole foot when I try to pull it off at the end. That's the tendon. Yes, Miss Smith?
Is that just the fascia from the the outermost layer, or is that the fascia coming through on every single fiber at the end?
Excellent question. Every single fiber. And that's why you don't tear this stuff off your bones so easily, is because you want every single little fiber hooked on somehow. This picture, in a way, this picture does not show every single fiber, but you see how this picture, if you see what the tendon is up there, it's part of the muscle down here. We call it muscle here, We call it tendon up here. Does that make sense? It's very funny, but it's there throughout the whole thing. All this fascia in here, all this epimysium, paramysium, endomysium, when the muscle disappears, just becomes the tendon. So really the tendon's there all along. It's just filled in with muscle. You know what's kind of funny? Periosteum is fascia around your bone, and it's just filled in with calcium and phosphorus. It's almost like your bags of fascia filled in with different material in your body. Muscles are fascia filled in with contractile tissue. Bones are fascia filled in with concretizing tissue to make them concrete. Nerves, by the way, you're later going to find out, are fascia filled in with nervous tissue. Blood vessels are fascia filled in with tubular material to create pipes. Your fascia babies. Mr. Bigelow.
So technically, would the tendon go from origin to insertion
Yes.
all the way through?
And if we add to follow Miss Smith's analogy, which was brilliant, to the tendons. I know we see one tendon, but it's really the tendon off every single muscle fiber. They're just all in the end. We can't separate them anymore. They all glued together. But the tendons run all the way through. So it's almost like you've got all these hollow tubes connecting to both ends, and in the middle we've got this contractile meat called muscle that helps pull them together and let them go apart. But you're right. The tendon goes from origin to insertion. That was a brilliant way of putting it. I've actually never put it that way before, but I would 100% agree. Now, we don't teach you that in anatomy. In anatomy, they teach us definitions, which drives me crazy. So they go, tendon connects muscle to bone. Well, yes, but the tendon is the muscle, really. It's just the center part's filled with actual muscle, the red meat part. The whole thing is tendon. You're right. Really well said. Yeah. This was very informative. Thank you. Anyway, that's why I showed you this picture. I'll never ask you again about epimysium, endomysium, paramysium, but I am going to talk to you again about, like, hey, that's wrapped in fascia, and that's wrapped in fascia, and that's wrapped in fascia, right? And you're going to be like, yeah, of course, dude. Cool. But it's good to know that tendons attach muscle to bone. And that's fascia. Aponeurosis is tendon, but it's smushed out in a sheet. And you've got it in your tummy, your head, and your back, especially, because you want to attach a whole bunch of stuff into it. It's just sheet-like tendon, or sheet-like fascia. Both statements are the same thing. Retinacula is what Ms. Smith was talking about, I think it was, around the ankles and the wrists. That's retinacula. It's just ribbon-like fascia to help wrap stuff up. Basically, if I ask you any question in class and you just say fascia, you'll probably be right. This is important to know. Yes, Ms. Tops.
So it's basically just like fascia in different shapes and sizes, and they put different names on them.
Yes. I was looking around to see if I had my saran wrap, because what I do is I get out a big sheet of saran wrap and I say, this is fascia, right? And that is fascia, by the way. If you guys have ever prepared, by the way, yes, Ms. Tops, yes. 100% yes. You said it perfectly. But have you guys ever been preparing chicken breast and you can, like, pull off that really thin sheet of see-through material on top of the chicken breast? Have you ever seen this? This is funny for a vegan to be giving you all these meat examples, but that's where fascia is found. That's fascia. That's superficial fascia. And you know, it's super thin, but it's really strong. And that's just one little layer. Well, if you overlayer those layers and you get a lot of them, you get aponeuroses. Just get slightly thicker sheets. Well, if you fold those sheets over, you get a ribbon of that, you get retinaculum. If you wrap it up into a rope, you get tendon or ligament. Yeah. And don't get me wrong, fascia is made out, sometimes it has slightly different amounts of what's called collagen and elastin, but it's all fascia, and Ms. Tops is 100% correct. It's just in different shapes and sizes. And sometimes consistencies, in the sense that sometimes it's got a little bit more elastin because we want a little stretchier there, and sometimes it's got a little bit more of collagen, which makes it stronger. But all of it has elastin and collagen in it, all of it, and just slightly different amounts depending on what's needed to be done. Just like slightly different shapes depending on what's needed to be done. Yep, well said. It's all fascia. So, the all or nothing law and the recruitment law, you don't need to remember these names, I just want you to understand the concept. Muscle fibers, so when you have a muscle, like my bicep here, it doesn't have like 10 fibers in it. I don't know what the amount is, but it's got 1 million, 2 million fibers. That's not an exaggeration. It could be more, give or take 1 million. But it's got a lot, millions of fibers. And it literally has an electrical wire called a nerve going to it that sets off either one wire or a group of them, sometimes 10 or 100, depends on what it's trying to do. Those wires only know one thing. They only know to contract like hell or to not. So when I am lifting up an object delicately like this pen, I am actually not doing that by telling my muscles to fire lightly. I'm actually doing it by telling only a couple of fibers to fire, because the fibers try with all their might. So muscle fibers pull 100% with all their power every time. So right now, I've got maybe 10 fibers firing with all their power, all their might, working their buns off, and the other million are just hanging out. So they're really only on or off. They get a signal from my brain, and it goes pop, and that fiber starts pulling as hard as it can. It's just 10 fibers, by the way. 10 fibers is about how much you have in your eyelids. 10 fibers is about enough to lift up an eyelid. So when things start to get, this might actually be like a 50 fiber kind of weight here, right? And in the gym, you might be lifting like, I'm not kidding you, 5 million fiber things. But the fibers pull as hard as they can. And that's called all or nothing. Your nerves fire all or nothing, and the fiber fires all or nothing. So you don't get like a mild, there's not a dimmer switch on my nerves. It's a light switch. It's either on or off. My brain goes, click on those fibers, signals goes down, those 10 fibers go as hard as they can. But 10 fibers pulling as hard as they can isn't that hard. So the way that we get more power is what's called muscle recruitment. My brain says, oh gosh, Tapscott just switched from a pen to his coffee mug. Those 50 fibers aren't going to do it. It flips some more light switches and recruits more fibers. Now it's got 400 fibers going, or 4,000. 4,000 is not that much, to lift this coffee mug. That's how it works. They either go all or nothing. It really is a switch that's flipped. It really is an electrical signal, essentially. There's a chemical thing going on there, too. But the fact is, there's a charge going there, and that fiber pulls as hard as it can, and if you need more strength, you pull more fibers. And if I'm doing something very light, by the way, if you ever held something out on the side like this, like a book, and it gets really hard, but it doesn't take all your strength, right? What your body does is actually recruit new fibers. It goes, okay, you 500 fibers here, you're exhausted. It'll kick in another 500 and let these guys rest, and kick in another 500 and let these guys rest. You don't know this is happening because it does it seamlessly, because your body is freaking amazing. But that's what's happening. They're all working as hard as they can. Your brain's just switching them around. Mr. McClure, yes, sir.
Do you know the process for how muscles grow? Like, you gain more muscle, but do you know what's happening there?
No, and I'm embarrassed I don't, because it's because there are two different theories. And the question is, do you grow more muscle fibers, or do those individual fibers get actually thicker themselves? I would suspect you grow more fibers. That would be my suspicion, because the cell can only get so wide. So I would guess you grow more fibers, and that's how muscle grows. And it grows because, by the way, your body's very intelligent and gets a response that there's not enough strength there, and it actually sends a growth signal to grow more. So when you work out to exhaustion, your body gets the signal that there's not enough power in that area, and it actually tries to grow more muscle mass to compensate for it. I suspect it does that just by making more fibers. I don't think it probably actually makes the individual fibers thicker. Because they would have some cellular problems if that happened. Yeah.
Fascinating.
It is fascinating. By the way, there's one other thing that happens too. Any of you who've started a workout program, maybe the first month you're like, you gain strength like that. Some of that's actually not muscle growth. Some of that's muscle recruitment. What do I mean by that? My brain gets better at going, oh, I know when I do a bicep curl, I have to fire these particular nerves. It actually gets better at firing the nerves. It brings on more nerves more effectively. And so you get really rapid gains in the beginning because your brain gets better at telling your arm to do curls. We think we're great at this, but unless you've done this exercise exactly perfectly in the gym and stuff, you don't practice that brain movement very often. And so you get this rapid advancement as you get better at just using the fibers you already have. But then Mr. McClure, you're right. Eventually, you've got to grow new fibers. Yeah. And that would be where the muscle mass would come from.
Cool. Thank you.
And that's muscle recruitment, everybody. It's just a good concept to kind of know because it's how your body works. So the terms aren't that important, but it's just a good concept. ATP is good to know because people might talk about it. It's just where you get energy. It's kind of the sugar for your muscles. It actually comes from sugar in a way. It's the gasoline they burn, and they basically burn it. Miss Dowler.
Yeah, is recruitment the same thing as muscle memory?
Oh, curse you! I don't know. So I might have to think about this with you. So are you talking about muscle memory when people seem to regain muscular strength quickly, or about learning a movement? I suspect. Well, that would be yes.
Like
yes, yes. I agree with you. I think recruitment or your ability to recruit well would be muscle memory. Yes.
And eventually, like, your muscles learn it, so your brain doesn't have to send the signal anymore.
No, actually, respectfully, I know why you think that. What actually happens is it becomes a subroutine in your brain. So here's what I mean. When we all learned to walk, you guys don't remember, but you were like this, and you fell over a lot, and people clapped and gave you all this praise and finally learned to walk. The reason walking was so hard is you literally have to send millions of signals. My brain actually has to sense the ground underneath me, tweak my feet, send signals to tighten up those muscles, keep me over here, watch my balance, slightly tighten up my quads, pull back my glutes, do all this stuff. There's honestly like 150 muscles involved in certain fibers firing, and I wouldn't even be able to talk to you if I had to think about all that. But what happens is, this is really important by the way, our brain creates a subroutine. It starts to go, oh, when I walk, I do all this stuff, and Mr. Tapscott probably doesn't need to think about that stuff anymore. So now, I just have to say I want to walk over there, and my brain kicks in that subroutine. It's subconscious. The reason this is important, by the way, is we do this with other things in our life, and some of our subroutines are good and some are bad. But like PTSD is a subroutine. It's when I hear that noise or see that thing, this is going to happen, and that subroutine kicks in, which is why we feel triggered. That's just a subroutine. That's something we've learned for survival. Subroutines are good, but sometimes we want to be able to rewrite them too. Some of our clients come in with subroutines where they've learned to walk this way. This is what they do. We are trying to flatten them on the table to actually teach them a new subroutine. So anyway, yeah, the muscle recruitment becomes a subroutine and your subconscious takes over so that you can do other things.
Thank you.
Thank you. Mr. Kachekian!
So I'm trying to make an analogy for myself. Like when you're exercising and you're lifting something really heavy, and it's really difficult the first time or something, and you're not sure, you're lifting it for the first time, so your brain is getting the signal for the first time that you need to push it as hard as you can.
Right. Which is really pull it as hard as you can, but yes.
Yeah. So is that then imprinted in your brain for the next time you do it?
Yeah. Your neurons in your brain, actually, neurons that fire together wire together. Your neuroplasticity means your brain actually does change its shape. And as you fire neurons together, they start to hook together. And those firings become more automatic.
Okay, that makes sense.
Right. It's literally what I'm trying to do when I ask you guys a question over and over again. I'm trying to get your neurons to fire that question over and over again until it becomes just automatic. And that's how memory is formed. That memory is formed by doing something over and over again until the wiring in your brain actually changes, where that memory is pretty hardwired in. Yeah. Mr. McClure.
So when people's physiology changes because they're healing, does that mean it happens in the mind first?
That's a great question. I think so, sir. I can understand other things being argued.
Because if it's just firing to the muscles, but it's from the brain first.
It is. Yeah. I think all healing has to come from the brain first, for the reason that you just said, but also because they have to believe it's a possibility before it can even really happen. You know, you have to break up the neuroplasticity. You have to, like, they're so set in this pattern that you have to at least introduce the concept that pattern can be changed, and they have to relearn it and such, yes. But sometimes making a client feel better reintroduces to their brain that they can feel better.
Like what we were talking about with just loving people.
Yeah. It's very effective. Yeah. But anyway, I'm right there with you. Yes. Yes, sir. I think so. Yeah. I think it all comes through your brain first. So anyway, I just showed you ATP because everybody talks about ATP, and it's adenosine triphosphate. It does not matter. You're never going to hear it in massage, but I would hate, like, it's the power, it's the thing that powers all your cells, everybody. It's when you eat food, it eventually gets turned into this chemical that when it breaks apart can power your cells. Your cells need gasoline just like a car. And by the way, there's some similarities too. They need some oxygen to burn that gasoline, and that's why you breathe in oxygen and all that stuff. There's a lot of similarities. But that was just because it's kind of important. We do know, remember, this is just review, but sometimes it's confusing. Prime movers are agonists. When I'm doing bicep curls, my biceps are in agony, and they are the prime mover of this exercise. They are the thing creating the major movement. Antagonists are the thing that could stop the movement. In this case, it could be my triceps. If my triceps are tight, I am not only curling my 30-pound dumbbell, I am fighting my triceps, which makes my 30-pound dumbbell feel like 40 pounds. That is extremely important because athletes will come to you because you can give them instant improvement. And you're not making them instantly stronger, but you're instantly removing the antagonists that are holding them back, and it seems like they're stronger. If my triceps have always been tight and you loosen them up, all of a sudden I can curl more weight because I'm no longer taking the triceps along for a ride. If I'm a runner and one of my quads here in front is tight, my rectus moris specifically, I can't pull my leg back to run. My hamstrings are actually fighting my quad here. If you loosen this quad up, and that was the problem, it has to be the problem. If it's the problem, I actually run faster. My hamstrings didn't get any stronger, but they're no longer taking the dead weight of trying to fight against my own body. If my cute little Honda Fit is no longer pulling a trailer, it seems so much more faster. Right? It is faster. But it's not a more powerful car, it's just got rid of the dead weight. So often in massage we care about antagonists more than agonists. Right? Quite often we're worried about the thing stopping movement, holding back movement, the thing that's locked in a contraction more than the stuff that's actually creating the movement. Fixators are exactly what it sounds like. They fixate stuff, they stabilize stuff. We don't think about it because, again, our bodies are amazing. But when I do a bicep curl, believe it or not, my whole arm wants to go all over the place. So all this stuff locks my shoulders down and fixates it. When you guys are doing a squat, your prime movers are things like your glutes and your quads and your hamstrings. Those are your agonists. But you have all these stabilizer muscles to make sure you don't fall over. Right? Those are stabilizers. They just stabilize you. Don't overthink it. So if stabilizer is a fixator, it's the same thing. It just holds something in place. I don't care about these definitions. I have them up here for a reason. I do not care about these definitions. I have them up here for a reason. Do not memorize these things. They're stupid. So, but they're up here for a reason. The reason's not stupid. All they're saying here is some muscles cross over more than one joint. So I gotta think of one that just crossed over one joint because your biceps cross over two joints actually. Well, let me use that as an example. My biceps are biarticular. You'll never hear me say that word again after today, but the concept you'll hear again. They cross over my elbow and my shoulder, which means my biceps, yes, they can create a flexion of my elbow, but believe it or not, they can actually help to create a flexion of my glenohumeral joint. They cross over two joints. Now, why am I making a big deal out of this? Because we find that muscles that cross over multiple joints tend to be more important from a structural point of view. They tend to cause more problems. If I have a little muscle going from this little phalange to this phalange, I only have to worry about it affecting that movement. And it's rare that I have a problem with that movement. But when I have a muscle going from below my knee to across my hip, that affects a lot of stuff. So you will hear me make a big deal out of muscles that cross over multiple joints. You'll never hear me call it biarticular or multiarticular or whatever, who cares. But I do care about muscles that cross over multiple joints because they affect your posture a lot. They're complex muscles. They can pull on multiple things at once. If my biceps are tight, they can make my elbow go like this, but they can also make my shoulder go up like this. They can do multiple things. If you think about it, some of the most multi-articular muscles you have are in your back. Those spinal erectors, the erector spinae group, spinalis longissimus iliocostalis, they go over 24 joints. You got 24 vertebrae in your back. That's multi-articular. And so they matter a lot. They can pull on your back in all sorts of crazy, weird ways. That's why we care about them. I just want you to understand that concept. When muscles cross over more joints, they tend to become more important structurally. They just tend to be. You won't find that in a textbook. It's just something I'm sharing with you. That's it. That, to me, let's hope that stops sharing. Sorry. That, to me, is kind of a summary of those 3 chapters and things that are really important. And I would say out of everything I shared with you, it's that there's fascia everywhere filled with different stuff, and it's about the actions. Those are the 2 most important things. You should know flexions, extensions, abductions, adductions, pronations, supinations, plantar flexions, dorsiflexions, rotations, circumductions, all that stuff, because you're going to use it in kinesiology. And then fascia. Fascia, 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 fascia. My body's just fascia filled with hard stuff that makes it a bone, contractile stuff that makes it a muscle, more fascia stuff that makes it a ligament. It's just all fascia. Cool? All right. I think we're too close to the end of class to roll out muscles at this point. I do want to do some muscle review, some kind of fun muscle review. I think you'll actually like it. But I think we should release your homework, unless anybody has any more questions, which I also invite. That is absolutely great.
Unless you prefer us to not have homework, that would be,
Oh, if I prefer, I do actually, Ms. Cuppage, I do prefer you to not have homework, but you're gonna have homework. Like in a perfect world, I would give you no homework, but you should. Yeah, this is important. Yeah, you don't want homework tonight, huh? You got stuff going on.
Little did I realize there was going to be homework every night.
Yeah. Yeah. Well,
thank you for that. Thank you for all that you did that we did that.
I thought you meant thank you for the homework every night.
No.
You won't have homework probably for the next 5 nights. Sweet. Yes. Miss Stewart, you have your hand raised. Save me.
Yeah, I was wondering about our makeup days this Thursday and Monday. So what does that look like? Because I am going to like a music festival this weekend, and I want to leave on Thursday, and I'm supposed to be coming back Monday. So like, do we have lecture? Do we have lab?
These are all really good questions. All right, let me release this homework here. Hold on. Then when I answer your question, it's just one homework assignment, guys. But of course, it's a review, so it's probably fairly substantial. How many hours do you have to make up, madam?
That was the other question I had too, because I don't know. I've only been 1 minute late to class once.
Oh, well, then you'd have 15 minutes.
Freeway. So I bet, yeah, I don't know how to check that. Like,
there is no way to check it. You should be able to check it, but you can't. The system's broken to check it. I was going to calculate hours right after this class, but I can tell you if you are accurate about that, that you're going to have a very good day tomorrow, and that you are going to be able to go to that festival early. Because this class ended in a very weird way this time, and tomorrow is not. I'm just looking at my calendar, make sure I don't get anybody's hopes up for no reason. Wait 1 second. Bear with me. And again, I'm assuming that you have an hour or less to make up, kind of thing. But it sure sounds like, from what you just described, that that's the case. So, if you guys have because the way, it's a 175-hour course, and so it ends at an awkward time tomorrow, which is good. So, tomorrow is actually not technically a makeup day, but you can make up some hours tomorrow, because the class ends early. So, to answer your question really quickly, Ms. Stewart, we will have a 3-hour lecture tomorrow, and we will have a 3-hour lab tomorrow. And you even have the ability to stay a little late for lab tomorrow if you have a little extra time you want to make up too. But what I'm suggesting is the class ends partway through lecture tomorrow. So I was going to wait for tomorrow to surprise some people, but for those of you with like perfect attendance, partway through lecture, I'm going to be like, it's been a pleasure. Go start your 5-day weekend. Yeah. And if you have just a little bit of time to make up, you'll be able to actually make it up in lecture. And if you have more time to make up, if you're not ridiculous, you'll be able to make up in the lab tomorrow. You may not even have to come in Thursday. And my calculations show that if everybody's willing to put in some time, nobody, and I mean nobody, has to come in Monday because of this skitty-wampus way the class ended. It gave us extra time tomorrow. And so tomorrow almost acts like a makeup day, at least part of it. And so we can squeeze in quite a bit of hours tomorrow. And so if nobody's late to lab today, and everybody shows up tomorrow and all that kind of stuff, we could complete out your hours for everybody this week. But if you have perfect attendance, by the way, your day is going to be very short tomorrow. And Ms. Stewart, if you're missing an hour or less, I realize it might be much less, but the point is your day is going to be very short tomorrow.
Okay, cool. So yeah, if it is just 15 minutes, I can just do it tomorrow.
And the only reason I'm hesitating is I want to go check and make sure my records show the same thing as yours do. But I'm sure they do. We're pretty good with that stuff. And so, yeah, you're going to have a short little lecture and one hell of a weekend. Yeah. Miss Tops.
So I know that you made a comment saying that we're not going to have much homework during our 5 days. Do we know what we're looking at or what we should expect?
Oh, thank you, Miss Tops. I'm so sorry. You won't have any homework during your 5 days.
Oh, thank you.
Sorry. You will have we will be done with class. It will be truly a break, and you will not have any. Some people that have to do makeup might have some homework during the makeup time, is makeup work or whatever, something to do that's massage related or whatever. But nobody's going home with homework after the class is over. So it depends on, but my point is, yes, there will be no weekend homework. Nothing is due Tuesday, which is when the next class starts. Nothing is due Tuesday when the next class starts. For many of you, tonight's homework is the last homework you're going to get. Some of you might have one more assignment if you got lots of time to make up, and we're going to do some review. That might happen. But again, it won't be for over the weekend. It'll be for while we're together. Yeah, no homework between classes. You're going to get a true break. You should celebrate this success. Like all 24 of us here, and I know everybody has lots of obstacles in their life. I don't take that lightly, right? I know some of you, are struggling with transportation, housing, feelings, money, food, me, and you guys have all made it here. Yeah, and so you will be able to celebrate and be like, woohoo, quarter of the way through massage school, and essentially school doesn't get any harder. And there are some longer tests or whatever, but if you made it through the first quarter, you can make it through the next 3 quarters. It doesn't, So yeah, this is great news. I'm super excited. I didn't mean to not convey that. I'm actually very excited. And what's really exciting too is if we get all your guys' hours done on Thursday, I can give Mr. Ibarra and Miss Bauer Monday off. And that's very nice for them too, so they can get a little break too. I have a board meeting. I can't take it off, but it's very good. So, did you guys see your homework? It should be released, I believe, for everybody. It should just be one assignment. I think it's 99 points. Does it show up? Okay, good.
Abby asked a good question. What are we starting off our next block with?
That is an excellent question. I don't know the answer to. I have to go look in Canvas. You guys are in the thoracic region. It's probably abdominals or something. Yeah. And you're going to do like the nervous system and the endocrine system and things like that. This course really should just be one class. We literally chopped it up into 4 to do you a financial benefit, because what would happen is it's really just one class. We just literally went, that's 175 hours, and we chopped 700 hours in exact equal portions. And we didn't break up the curriculum. The curriculum just kind of starts like after a 5-day weekend. We just kind of jump right back into it with no homework during the 5-day weekend. Anyway, we did it that way because if you flunk out of a class or you drop it, you have to pay for that class again. Well, if we didn't chop up the class into 4 parts, if you dropped this class, you'd owe us $4,000 again. This way, if you drop this class, you only owe us $1,000 for that class, and you can pick it back up again. So we literally did it kind of to protect you. I I want you to be protected. I would prefer just call it massage therapy. You go to school, you sign up one day, we go 8 months together, and we're done. But anyway, that's why that's there. We just literally went up 175 hours, chop it. And we made fake classes so that you would not get screwed. I had a gentleman actually who's going to, I think, be joining us for this next session, and he had to drop after this class. He finished this class, but the next one he had to drop partway through, and that way he doesn't have to pay for the whole program. He just comes back and kind of picks back up there. So that's why we did that. And that's why it's very weird. It'll just seem to you like Tuesday, you'll be like, oh, it's just like we're back in class again, like we didn't even miss anything. We just had a long weekend. That's it. It'll be the next page in whatever book you're in.